Madam Deputy Speaker. I beg to move the motion that this House calls on Government to take steps to help reduce the number of children entering care by bringing forward measures to support more children to remain safely at home with family or extended family. I am most grateful to the Backbench Business Committee for allowing this debate to be brought forward. The voices of children in care and their families are rarely heard. Yet it is they who are amongst the most vulnerable in society and who have the greatest need of representation. Over recent years, we have seen steadily rising numbers of children being taken into care. There are now 70,000 looked-after children in this country. The rise began in response to the very tragic case of baby Peter Connolly in 2008, but it has continued to increase. And there are some who argue that an increase of children in care shows that local authority children's services are getting better at identifying children at risk of harm, and therefore a rise in care, children in care, must be a good thing. But you only have to look at the outcomes and life chances of care leavers to realise that a childhood in care provides its own risks. There are many deeply saddening statistics that I could cite: levels of poverty, addiction, suicide, poor educational attainment, over-representation in the prison population, and higher levels of mental health difficulties compared to the population as a whole. But perhaps the saddest statistic is the number of care leavers whose own children are then taken into care. A self-perpetuating cycle of loss, wounds that never heal when the bond between parent and child is broken. Children in care will tell you of multiple fostering placement breakdowns, the sense of being unwanted, unloved, abandoned, the loss of identity, of being split up from their siblings and grandparents, and repeat changes of schools and loss of friendship circles, and that feeling of never truly belonging. The tragic high-profile cases of child abuse and neglect has left professionals with an entrenched fear of getting it wrong. Understandably, they face significant pressure to take steps to secure the removal of children rather than find the optimal solution for every child. Now, I say that if the state is going to intrude in the private family life of an individual, it must guarantee better life chances for those children. And of course, the welfare of a child must always come first. But in many cases, a child's welfare is best served by staying with their parent if that parent can be supported properly, rather than just an uncertain future in care. Instead of support when experiencing family stress, the situation may be left until a crisis point is reached, and then the family experiences compulsory state intervention. Inevitably, this is a time of scarce resources for local authorities, but it's hard not to argue that prevention is better than a life in care. Yeah. Yesterday, Anne Longfield, the Children's Commissioner, gave evidence to the Education Select Committee on the point of early intervention, and she spoke very powerfully indeed about the benefits. This is a vital stage in child protection, and it can, in these difficult financial times, be in danger of being bypassed. Instead of care proceedings being the option of last resort, which it really is intended to be under the legislation, many families find themselves on a track where too often there is only one outcome. And this is a trend that media, families and campaigners have been talking about for a number of years, and I do believe the message is starting to get through. And I am encouraged that there is growing acceptance that more can be done to help families stay together and to stay together safely. It has to be better for society, it has to be better financially, and most importantly, it is better for children. In Telford, my local council understands this. Their focus is on ensuring that children and families receive the right help at the right time. Their Strengthening Families programme supports families with deep challenges, which in turn ensures that more expensive, more damaging interventions do not become necessary. And central to this successful scheme is the implementation of something called Family Connect, which is a single multi-agency front door for children and families. And there are other examples of good practice helping children on the fringes of care to stay out of the system. Now, many MPs will have had correspondence from constituents desperate to keep their children out of the care system and keep their family together. And usually by the time families are in touch with their MP, care proceedings are underway and there is nothing that we can do. Parents are frightened, angry and overwhelmed with the monitoring, scrutinising and the building of a case against them that is never intended to be supportive or conducive to building stronger families. There's an organisation called the Family Rights Group that provides free, specialist legal advice for families caught up in what can be a nightmare. It helps families navigate the complexities of local authority child protection investigations, enabling them to have a more constructive and more informed relationship with social services. Demand for this organisation's services has doubled since 2010, and only 4 in 10 callers can be answered. The Department for Education funding for this organisation is due, according to Family Rights Group, to end in March, and I would urge the Minister to think carefully about the benefit of this organisation and whether that funding can be renewed going forward. I don't accept that continued increase in a rise of children in care is inevitable. What sort of society would it be if we were to assume that state care will do better than parents? I believe, and this is based on working with families caught up in the child protection system, that most parents, however difficult their circumstances or background, most parents set out to do the very best that they can do by their children. And the first step must be to help them achieve that goal. This is not a mindset that is necessarily prevalent in the world of child protection. In fact, in some cases, it is the reverse. A professional, and by that I mean a health visitor, a teacher, a nurse, a GP, A&E doctor, anyone interfacing with a child, is encouraged to think the unthinkable. And what do I mean by that? That is that any parent, including any one of us, might be capable of deliberately harming their child. And the net in which families are caught is being cast wider and wider. Today, 1 in 100 children in England are subject to child protection investigations. It's an increase of 79% in 5 years. And as professional anxiety rises, support services dwindle, the consequence is more children spending a life in care. A parent fleeing a violent or abusive relationship, one seeking help for mental health problems, or those who've had themselves a childhood in care, they may all be considered a risk of future emotional harm to their child. A risk of future emotional harm is assessed on a pattern of potential risk factors: poor housing, single parenthood, poverty, an abusive partner, and these all combine to create a risk that a professional simply cannot take. And all too often it is those that are most disadvantaged who are affected by this system. There will always be children who are not able to stay safely at home, and it is a difficult and challenging task to identify those children correctly. We are told, as these matters are decided by an independent court, we should be confident that the correct decision will always be made. Now, Madam Deputy Speaker, I say to this House, a court can only decide a case based on the evidence before it. Evidence put before a court by child protection professionals, and that evidence is often dominated by opinion. The court does not have the discretion to disregard professional opinion in favour of a distraught parent desperately trying to navigate the complexities of the legal system, desperately trying to prove their innocence up against the full might of the state. Now, the motion asks the government to support more children to remain safely at home. And there are many examples of good practice that the government is currently undertaking, such as the Troubled Families Initiative, the Children's Social Care Innovation Programme and the Pause Project in Hackney. I would like to conclude by briefly asking the Minister to consider some other alternatives to helping children stay safely at home with their families. We know from recent research that when a mother has a child removed, the trauma and the loss often results in multiple repeat pregnancies. Those children, sadly, are almost always immediately taken into care. And I have sat in an adoption and fostering panel where a mother came back 10 times and nobody ever addressed the mother's issues, and those 10 children were taken into care, which comes to the point of the honourable gentleman opposite about the cost effectiveness of dealing with the difficulties that a mother in that situation would experience. So I would ask the Minister to consider therapeutic intervention for mothers at the earliest opportunity, as it's cost-effective, and care simply isn't the answer that professionals would like it to be. I know local authorities are required to consider these points. The preliminary steps are difficult and potentially fraught with risk, and that's the reason why they are so often skipped over or dismissed. And the words used so often are, oh, well, it would be inconsistent with the child's timeline, or not in the best interests of the child, or that it shows unmerited optimism to assume that rehabilitation and reunification is an option. I want to move briefly on to the role of kinship carers. I believe they perform an invaluable role. Where a child is placed with a grandparent or member of extended family, and again in my experience, as an option, it's often overlooked. And there has always been a stronger focus on adoption. And I would urge the Minister to consider more support for kinship carers and to continue to encourage local authorities to see this as often in the best interest of the child, because it allows a child to stay with siblings and within a familiar context. And relatives are so often dismissed as being inappropriate because of their connections with the child's natural parent, which was found wanting. No family is perfect. It's about good enough parenting and the sense of belonging and identity that is irreplaceable for any child. I would urge the Minister to support the family rights group so parents can have access to free and independent advice at an early stage in any investigation against them. I'm actually so encouraged by what I've heard from both the Minister and also from the Prime Minister, because he has always been committed to strengthening families and seeing families as the bedrock of society, and he's recently spoken very passionately and sincerely of his desire to see fewer children in care. He's also said the way that the care system and the plight of children in care shames our country. He's spoken of his commitment to the life chances of the most disadvantaged young people. So it may be, Mr. Speaker, that with this motion I and other members who are supporting it are pushing at an open door, and I very much hope that that is the case, so that this sense of belonging and security is something that can be part of every child's life. Thank you.